Okay, we're picking it up right here, continuing on part 9, page 415 here in the neurotransmitter table. And we just finished up with dopamine, and we're moving on now to serotonin, a very famous molecule in modern times. It's thought to be inhibitory, but it has many indirect and second messenger potentials and possibilities. It acts in the central nervous system, and it also acts in the gut. So that's kind of interesting, and it's definitely a part of the limbic system, and plays a role in sleep, as it says here. Drugs that block its reuptake from the synapse would be Prozac, amongst other molecules similar to Prozac. Reuptake molecules are molecules that once the neurotransmitter is released to the fluid of the synapse, then it does not get metabolized. It stays there. It does not get taken back up into the presynaptic membrane. It's supposed to relieve anxiety and depression, and one of the things that we experienced as medical students in my time in the 1980s, when reuptake molecules were becoming more available, is that it was believed by psychiatrists that serotonin might be involved in self-reward. That is to say that we have a tendency to feel as though if we've done something well, we feel good about ourselves. And that so it's something that happens when we wake up after a long and deep sleep. We feel good. So we're in a good mood oftentimes under those conditions. And that if we get our work done and we're, how shall I say, productive and also well scheduled and everything, we feel good about ourselves. And so by taking Prozac and also asking the patient to do, how shall I say, self-regulatory and self-care types of things, it was a way of they thought at the time that it would be a way of treating depression and anxiety. Turns out that if you continue to rely on the Prozac, though, and the reuptake inhibitor action, serotonin, that you really haven't done anything on behalf of your patient. Your patient is not creating their own serotonin, as it were. Anyways, the activity is blocked, it says here, by LSD. It's enhanced by the effects of MDMA, ecstasy. So there are certainly many features of serotonin when it's in either low supply or higher supply, makes a difference. Then we have a very important molecule, again, which is histamine. Histamine is a mediator of inflammatory reactions. It can be excitatory or inhibitory, depending on what's going on and where it is. Histamine can be in a variety of places of the body. It's involved, it says here, in wakefulness, appetite control, learning, and memory. I forgot to mention that serotonin, by the way, is a gut-brain molecule, and that it is something that's released at the time of eating, right? So sometimes we attempt to regulate mood, I would imagine, through comfort eating, because there is a release of serotonin from that. Now back to histamine, wakefulness, appetite, learning, memory. So it has a central nervous system function, but also we're going to be learning when we get to the digestive system next semester that you can't get the release of hydrochloric acid from the stomach without histamine. It's one of the 3 keys that unleashes the release of acid, strong acid. So that's sort of an interesting little detail. Of course, it's one of the constituents of mast cells, and whenever we have type 1 hypersensitivity and the release of histamine from mast cells as a result of pollens and danders and things like that. So type 1 hypersensitivity, asthma is in that area. Okay, then we have Gaba. We've already talked about Gaba. It's almost universally inhibitory. I would submit to you that people who get to be my age or older have a lot less Gaba, and they're disturbed by loud sounds and activities. And so I'm afraid that as a child, I must have been really, how would I say, quite annoying to the older neighbors in the neighborhood, because we played a lot of things in my neighborhood where the kids were loud, and the older neighbors. It's not funny, of course. It's very disturbing that children like us were loud and crazy and having way too much fun when we should have gone to the athletic field. At any rate, so that's the nature of things. Sometimes you'll be dealing with older patients who are quite grumpy, and they just lack Gaba. Okay, so it's an important molecule. Principal inhibitory neurotransmitter in the brain, important presynaptic inhibition. We've already talked about that. Augmented by alcohol, augmented, of course, by Valium in barbiturates. And so it's an important component in the use of our drug system for calming people down and relaxing the body and that sort of thing. So some people just naturally have more of it, and if you're younger, you probably do, and if you're older, you might be lacking in GABA and much more sensitive to things like sound and light and that sort of thing. Glutamate is a neurotransmitter, amazingly enough, quite excitatory. Of course, it confers taste of the umami persuasion. It does work in the central nervous system, and so it's considered a stroke neurotransmitter. Now, oftentimes when people do have a stroke, that is to say that there is a death of a particular neuron within the, or group of neurons within the central nervous system, there is a release of glutamate by those cells as they're dying, and it produces what's called excito toxicity, which is to say most of the damage of a stroke actually does not come from the death of specific neurons as much as it happens as a result of the literally buckets of glutamate that's being released from those dying neurons, and it actually causes death to many surrounding neurons. So there's basically literally stimulating death. It causes ischemic, oxygen-deprived tissue. So it basically makes a stroke worse, is what the deal is. And so treatment protocols for early activity and during a stroke is to block the effects of glutamate. Glycine, a very simple, the simplest, in fact, amino acid, is generally inhibitory, takes direct action. It's involved in the spinal cord and the brainstem and the retina, it says there. Principal inhibitory neurotransmitter of the spinal cord. Strychnine blocks glycine. So as a result, you get contractions, ultimately ending up in respiratory arrest elsewhere. But at any rate, the strychnine is a very interesting molecule because it makes you very sensitive too. It's so sensitive that just even a whisper sounds like a shout. At any rate, it's the principal inhibitory neurotransmitter here is what we're talking about, glycine. Then we have endorphins, one of my favorite molecules if you're a distance runner. Endorphins are released from the central nervous system, the brain and the spinal cord. There are enkephalins, which are much weaker molecules, usually released in the areas of joints and musculature. These are basically, they function as analgesics. Okay, so inhibitory, and they basically, how shall I say, treat pain. So substance P is a pain, how shall I say, cytokine, and so it's one of the things that is being mediated by opiates of various kinds. We use morphine, heroin, that kind of thing. Variations of morphine are used in the medical industry. Okay, and then we move on to the next molecule, Tachykinines, substance P. This is for pain. Neurokinin, they're excitatory. They're involved in the basal nuclei and the operation of fine motor control, peripheral nervous system, pain afferents. Okay, so basically we're regulating, let's take a look here, make sure we have the right situation, right? So we're regulating mood here through substance P and through other respiratory cardiovascular controls. Mood. Okay, we'll pick up the rest of it in the next part.